Okay. So the date is July 7th, 2021. I'm here with Alex Lenzen, who's an associate director at Dick's House. We're just going to be talking about some of the mental health policies at Dartmouth in the wake of the struggles we've had as a student body in the past year. So, how's it going, Alex?
Thanks for having me. I'm excited to be here. It's going pretty well.
Yeah, I'm excited. So, do you want to just explain like what you do at Dick's House briefly?
Yeah, absolutely. So I'm the associate director of the counseling center, and I entered this role in March. So previous to that, I was a staff psychologist here, and our the counseling center's role is to support students' mental health in kind of the best way we can. Most of the time, that's through short-term individual therapy. We also have psychiatric services. So we have psychiatrists here who prescribe medication and manage medications for students. And we have some other like workshops, like group experiences. We provide consultation and referral. So maybe the counseling center at the college isn't accessible to folks for a variety of reasons. Maybe they're out of state or on an off term. We'll help get people connected to community resources and providers. But really, we're trying to help with the overall mission of the college, which is to have people engage in a educational experience both in the classroom and socially and support their mental health and well-being while they do that.
Yeah, sure, sure. Can you walk me through just the past year? Because as Dartmouth students now, it's been a really tough time for us. I know a lot of students have thought that like the administration hasn't been very responsive and that like mental health services have been inadequate. And I know a lot of people feel like, like even the things that are being done are like, we don't know what's happening. Like there just hasn't been a lot of communication with us. So can you just talk a little bit about what the response has been like within administrators, behind closed doors, things like that?
Yeah, I mean, I can try to speak to that. I welcome additional questions as I talk if there
Yeah.
are follow-ups that you have. And, you know, I don't have access to all of those. When you say administrators, it depends kind of who you're
Yeah.
talking about.
Yeah, for
So I
sure.
don't have
For
access
sure.
to all of that information. But I think, yeah, this last year and a half has been really challenging in a variety of ways. And I think from my perspective, the counseling center's perspective, one of the biggest challenges that we faced was with COVID and having to go to all remote work. And virtual, teletherapy, that's not something we were doing at all before. So we had to transition everything that we were doing to be happening over Zoom and by phone. Um, and that is helpful for some people. For we heard some feedback that actually increased accessibility and helped people to feel even able to be more vulnerable where they weren't face to face. So there was like that eliminated a barrier for some folks. But it also made accessing therapy much more difficult for other people. So maybe they were at home in an environment where they couldn't get privacy, or they didn't want family or people they were around to know that they were engaging in therapy. Maybe that they were out of state. And so because of the laws and ethics that we're bound to by our professional licenses, we can't provide therapy and counseling services to anyone who's located anywhere. We have to be licensed in that specific space. So we're all licensed in New Hampshire, but if students aren't in New Hampshire, it's kind of a state by state basis, depending on what the laws and rules of that state are. Can we get licensed there? What is the cost? It got complicated quickly. Um, so it looks like you have a
Interesting.
question. So
So,
I
yeah,
yeah.
yeah. Wait. So if someone's in like a state that so therapist licensed by state, it's not a nationwide thing.
Yeah, which is in some ways it's good because that means you have to know the particular state guidelines. You have to be really informed of the rules and laws of that state. So that's part of why you're licensed in that state. But it also makes it really difficult and inconvenient when you have a student body that is mostly not from New Hampshire and is all of a sudden forced to go to other places. Then doing our jobs becomes a lot more difficult because we can't serve the people who we're charged with serving. Does that make sense?
Yeah, yeah, that makes sense. That makes sense. What about like internationally?
Yeah, so internationally, there's almost no a service available that we can provide. Again, we provide that consultation and referral. So what I mean by that is we'll talk with people who are located internationally, and then we will try to help them find local resources. And if there are financial barriers to connecting with those resources, we will try to get them connected with financial resources to help them access services. There is one service that is typically used for study abroad experiences. It's called International SOS or ISOS. And they are a service that the college pays for that allows students to get about, I think it's about 5 sessions free of therapy or medication management. I think it's both of those things. It's definitely therapy. So sometimes we're able to utilize that for people who are located internationally, but it's a significant barrier for people who are located and living internationally to access services through Dartmouth because we cannot provide those services, even if um, all other circumstances dictate they are appropriate for like short-term counseling.
So you said like financial resources. Does that mean like Dartmouth offers like financial aid for therapy or counseling?
Yeah, so it's really kind of on like a case by case basis, but yes, there are resources through a variety of offices on campus, sometimes like specific to certain student groups, so student athletes, first gen students, through the financial aid office. Sometimes the students who are on financial aid can seek support through the financial aid office for support for therapy resources. We have our own fund through the health service called the Devons Fund that we try to make available to students who are struggling financially but want to access therapy. So we try, like, we know of kind of where the pockets of money are a lot of times, and we'll try
Mm.
to help people figure out like what pocket of money is most accessible to you, and how do we get you connected with that so that you can, yeah, access the services you're looking for.
Gotcha. Yeah, I didn't know that. That's super interesting.
Yeah, yeah. Well, good. I'm glad to share.
Yeah, I feel like there's a lot of things at this school where like there's so much money lying around that it's just like, but no one knows it's there and no one knows what's going on. So it's like hard to access, you know?
Yeah, yeah. I think one of the things that I have found, and I don't know so much about like where the money is all lying around, and I'd love to know more about that. But I think one of the things that I found in working in the counseling center is we're really good at our jobs of seeing students, providing care, and we are less good at marketing and figuring
Mm.
out like how to communicate effectively what our office is doing. And I think that's something that we're really seeking to improve on, and something we've tried to do in the past, but that we're particularly thinking about now because when it's only student messages that are being received, sometimes some of those loudest messages are the people who've had really negative experiences, and those
Yeah.
certainly exist, and not at all denying that people have those experiences, but those aren't the only experiences that exist. And I think it's hard for us as a confidential resource to ever defend ourselves against the negative
Right.
experiences, and we can't really share about the positive experiences. So it's like figuring out a way to have people know more about us and what we do and who we are. Like, we're, human beings that are not like
Yeah.
up in some inaccessible tower, or I don't know. I
Yeah.
think there's sometimes a lack of approachability when we're not able to engage with the campus as people. And so I think that's something that we look forward to doing more once we're operating more in person and can engage with students better that way.
Right. So like, yeah, I think that's definitely true. Like at least in my experience, like my friends have definitely been like, like I don't really know what's happening with like, or I don't really know how to access Dick's house. Like, and even when you call, there's like, like you have to wait a couple weeks for triage usually, so it's like hard
And
to
that's
get the ball
actually not
rolling.
true. So actually, it's like, and I trust that that's true for some people's personal experience, but we offer triages on average 1 to 3 days from when a student's calling, and most of the time, the reason that people get pushed later is that they're saying, "Oh no, I don't prefer that time. No, actually, I want a morning, or I want this specific
Oh,
counselor," and again, that is a completely their prerogative to request that, but then they go up to their friends and say, I wasn't able to get in for 3 weeks. And it's like, well, we offered you an appointment today, but you didn't want it until 3 weeks from now because you're busy with other things. So it's hard. It that's where I start to feel defensive, and I need
Right.
to, I just need to sit with it a little bit, because people are sharing their personal experiences. That's how they feel it. Like, we couldn't accommodate them for 3 weeks, but it sometimes is like discouraging to other people who think, well, geez, I need help now. And if
Yeah.
I'm not going to be able to get in for 3 weeks, I might as well not call. And that's where we always have a counselor on call 24/7. So if you
Yeah.
really need support in this moment, you can call. We're going to have someone who's available for you. And if you don't need support urgently, it's not a crisis, but you're still wanting to get connected soon, we'll likely be able to meet you within 1 to 3 days if you are kind of flexible with your schedule, and that can make that happen. It's kind of how much you will want to prioritize it around other things like group meetings and stuff like that, which is tough. You all are busy.
Yeah. Yeah. Of course. Dartmouth terms are very fast. People are
Yeah.
busy. I'm kind of curious. So, I mean, maybe things have changed since I was, doing counseling, which I did like two
Hmm.
years ago. But when I did it, you had to like call Dick's house, and you had to be like, you had to talk with someone on the phone, as opposed to like scheduling something like online. So is that
Yeah.
like intentional or like?
So or I should say, it was originally intentional, because part of the reason we do that is the way our online scheduling system works. We have to block. This is maybe more information than you need, but I'll share it anyway. We have to block certain times to like assign them as triage space, right? Because we also have to keep room that might be available, but is for clients that we're seeing in an ongoing way. So we have to assign this time to triage space. And then when a person calls, or let's say they go online to schedule, they would only be allowed to schedule in that triage space, which really limits what's available. Whereas when a person calls, our clinical service coordinators who work in our front desk can say, oh, we have these triage spaces available, but this person also had a cancellation. So we can get you in today if you're available this afternoon. So there's just a little bit more flexibility that's not, for some reason that I don't understand, is not capable for online scheduling. That being said, we've heard a lot of this feedback that people would like to be able to schedule online. So I think we are working to move toward that. It's just kind of
Hmm.
catching up our electronic medical record system with that ability and making it fit for what we need it to work toward. So the answer was, let's see, I got off track with the question, but yes, it was originally intentional, and that was kind of the reason behind it. We wanted people to call so we might be able to get them in more quickly than they see what's available online. But given the feedback that we've received, it seems like having both options is going to be better, and maybe having a note like, call if you want to try to get something sooner, you can call and something else may be available, or having a note about crisis services on there, that might be sufficient to alert students to that while still allowing them to schedule online if they prefer.
Yeah, for sure, for sure. And like I feel like, everything's done by internet these days anyway.
Yeah.
I feel like you'd get a lot more like people
Yeah.
if there was as easy as like click of a button. Um, so like finishing up, is there anything that you think you would want like students to know, or anything that you think like the counseling center could like use in terms of like people knowing, or even just helping, or resources you wish you had, or something like that?
Yeah. I mean, I hope that at least one of the myths that we debunked was that if you talk about suicidality here, that you're going to be sent home. That is absolutely not true. I hope people learned that. The accessibility of services like that are average, like right now, if you called to get an appointment, you could get in tomorrow. So, like, the wait time is not as long as everyone says it is. Um, you don't have to have Dartmouth student group health insurance in order to access our services. Sometimes people think that. Um, yeah, mostly I just want people to know that it's okay to call our office and not really know what you want, and to even like not share certain things if you're not feeling ready to share those things. We'll still ask about them, but you're allowed to not answer. And we will then, as best we can with the information that you do give to us, we will make the recommendations that we have, and you can decide what to do with that. We really value autonomy and collaboration, and I hope that people, give us the chance to engage in that with you on an individual basis, and let, have um, the opportunity to form your own opinions and your own experience. And if after that you decide, nope, not for me, I didn't like it, first try another counselor. And then if you don't like it still, if it's, not about fit, it's about just like the experience, then yes, like you don't need to access our services. Counseling's not for everybody. Not everyone needs counseling. But if you're thinking like maybe I could benefit from this, give us a call, regardless of what your friends say about our services, see how you feel, and give us a chance to kind of meet you where you're at and provide what you need. Because I think in most cases, we can actually do a pretty good job of that.